I can't stress this enough. This is a stage where all of us have to be extremely vigilant in making sure we do the right thing and encouraging everybody else to do the right thing. In the case of my parents, I haven't let them out of the home and I won't, but we're making sure we provide what they need, and please do the same to your loved ones. But if you're someone who is at home and doesn't have anyone that can provide you that support, please contact us. We have already contacted tens of thousands of vulnerable people across the state, offering them support. If they haven't answered the phone 3 times after we've called, we've actually sent someone round to make sure they're okay. So please know you're supported. All of us are in this together. All of us have had to make major adjustments, and all of us are here to support each other. And I really today wanted to thank 2 parts of our community. Firstly, all of our frontline workers who are doing an amazing job. Whether it's our teachers, whether it's our police officers, and I'm joined today by the Commissioner for Police, and can I say the police in the last little while, they're always outstanding, but in the last little while they've been especially outstanding. They don't want to have to issue tickets on the spot for people doing the wrong thing, but they have, and they'll continue to do that because more than ever, we have to keep our community safe. And in particular, I want to thank all of our health professionals who've already supporting our hospital network throughout the state and our health system, but more importantly, we'll be asking so much of them in the coming weeks and months, and I can't be prouder of all of them. So no matter what you're doing in our community that's essential, no matter what you're doing to support everybody, we're thinking of all of you. And please know that I would never ask anybody to do anything that I wouldn't be prepared to do myself. If New South Wales has to take difficult decisions, we will, because we're at a critical stage where we want to stop the community-to-community transmission. That's critical for us to make sure the virus doesn't spread and we don't have more people in hospital than we can cope with. We never want to get to that situation, and that's why it's really important for us to ramp up our enforcement, ramp up our compliance, but also make sure that everybody has clear information. And I also want to thank everybody for your patience, because this week alone, there's been a lot of information provided about what you should do and what you shouldn't do. I want to thank everybody for your patience, but you've been responding. We've seen far more limited activity everywhere. We've seen a reduction in people moving around the community. Attendance at schools is 10% or less, and I suspect that number will continue to go down. So wherever you look, we are seeing people do the right thing, taking our messages, and I just want to thank everybody for your patience, and especially for those whose businesses have been so disrupted that they're now no longer in a job. But I also want to make this plea to everybody. All of us are doing our best, and I want to thank people in the business community who are supporting our efforts, people in community organisations who've stepped up, organisations that are working with us to make sure we keep people safe, and all of our workers who are keeping things going for all of us who need that, and I can't thank them enough. But really it's up to all of us now to come together to do our part and to really deal with the disease at this critical stage, because if we keep it contained as much as we can at this stage, we are better off in the next few weeks and months, and I can't stress that enough. So please heed the warnings. Please don't move around unless you absolutely have to. If you're an older or vulnerable person, don't even leave home. But please know that no matter what decisions our state takes in the coming days and weeks, that you'll always have a supermarket you can get what you need from. You'll always have a pharmacy. You'll always have those essential things that you need to use for your daily health. So please know that is never in question. There is no need to panic. There is no need to hoard. Those essential things will always be available. But you do need to really take stock of your personal movements, the movements of your loved ones, and also those in the broader community. I'll ask the Chief Medical Officer to give an update today. Then I will ask the Police Commissioner to give us an update on the wonderful work the police are doing to keep people safe. And also then I'll answer your questions, but can I please ask you to answer questions one at a time so I can get clear messages to the community? It's really important for them to hear what I have to say. Thank you very much.
Thank you, Premier. So as our total today is 1,405 cases, 877 of those cases are overseas acquired and 278 are locally acquired, but they're a contact of a confirmed case or part of a known cluster. The locally acquired with contact not identified is 145, and that has increased. And as the Premier said, that is the group that most concerns us because it represents community transmission without an unknown source. We currently have 134 people receiving care. Pleasingly, 62 of those people are receiving hospital in the home. We have 19 in ICU and 53 in hospital wards. Thank you.
Good morning. Thanks, Premier. Thanks, Dr. Chant. From a New South Wales Police perspective, we are out there. We are still patrolling the streets. The Police Operations Centre has been open for over a week under the command of Deputy Commissioner Jeff Loy. It's important to note that crime is actually down compared to last year in most of the crime categories. And what's it mean? The streets are safe and people are generally behaving themselves. So I would ask that we continue to be calm in the streets and calm at home. We know that it is challenging times, so that it is important to note that you are safe. You're safe in Sydney, you're safe at Homebush, and you're safe in regional New South Wales. We're 17,000 strong, 4,000 civilian police employees who are all turning up for work, and we will maintain public safety in the state of New South Wales. Now, 2 days ago, the Health Minister gave the Commissioner additional powers around a $1,000 on-the-spot fine and a $5,000 on-the-spot fine. I gave a clear warning that the time for cautioning people over not adhering to self-isolation was over. Prior to that, we'd received around 200 Crime Stopper calls for people not complying. Since then, that has gone up to 800, which is 600 calls in 2 days. Yesterday, we issued a $1,000 fine to a 65-year-old lady from Lake Macquarie. Now, what's disappointing, this lady had a caution on Monday, a caution to self-isolate. Yesterday, she was found walking around the streets. $1,000 fine. Yesterday, police from City of Sydney Police Area Command conducting business inspections, ensuring there is compliance, came across a massage parlour, $5,000 fine to the business owner, and 3 employees received a $1,000 fine. Of course, this brings me no joy, but whilst we are safe and whilst people are behaving well, we have to listen to the messaging from the Premier, from the Chief Medical Officer, if we're going to get through this and minimise the loss of life. So be sure the police will continue to turn up, will continue to protect you, but you need to listen to the messaging. And if you don't, you will get a $1,000 fine or a $5,000 fine. Thank you.
Premier, will you be pushing for tougher lockdown measures at today's National Cabinet meeting?
Look, I want to make it clear that I receive daily advice. I'm supported by experts on a daily basis, and I'll be going into that meeting putting a case for New South Wales. But I want to assure the community that no matter what decisions are undertaken today or tomorrow or in the next few days or the next few weeks, there is no need to panic and there is no need to worry about being able to get things that you need to keep you and your loved ones safe and well. So please be assured that is the case. But New South Wales and Victoria in particular, we've always been very forward-leading when it comes to making sure we're keeping the community safe. We've always been very forward-leaning in what we think should happen, and that continues. And you understand that we're the 2 largest states, but I also appreciate other premiers around Australia have similar views affecting their own jurisdiction. So I will continue to put a strong case for New South Wales, as I do at every meeting. I'm very pleased with the decisions we've taken at this point in time. I think the decisions we've taken in New South Wales have sometimes been a bit different elsewhere. But I'm very pleased that we've taken those decisions because we're able to an extent control, or control's the wrong word because you can't control a virus, it's so virulent. But we've been able to contain the number of people that are very sick to a low number, and that's what we need to keep doing. But as the number of cases increases and the number of people getting it from community members as opposed to people who've come from overseas, that tells us we're starting to see that increasing of the spread from unknown sources, and that's why we're stepping up the compliance, we're stepping up the advice we're giving people. You shouldn't really be leaving your home and moving around the community unless you have to, unless you have an essential job or unless you have an essential thing you need to do. And that's a really strong message I want to send to everybody.
If the state does go into lockdown, Premier, will you give us some notice? How much notice will you give? A day or 2 days?
Well, I just want to say to the community that I rely on the advice of health experts, and I also rely on the advice of people who are supporting the system in New South Wales. So therefore, I get advised daily, and that's why I've been very keen every day this week to say to people, if New South Wales has to do more very quickly, we will. But do not worry, because everything you need you'll still be able to get, and it's to maintain the safety of our community. We have the benefit of seeing what's happened overseas. We have the benefit of knowing what our hospitals can cope with. We have the benefit of knowing what the community transmission numbers are. And I do want to say thank you to New South Wales Health. We have some of the highest testing rates in the world, not just in Australia, but in the world. We've tested quite a number of people. Dr. Chant can correct me, but I think the number's around 90,000 people in New South Wales have now been tested, which is a good number because it means it gives us a good idea compared to the number of people we're seeing turn up in our hospitals. Because as the community-to-community transmission spreads, which is what we're trying to control, when people present to hospital, they might be in a very sick condition and we won't know or be able to trace how they got the disease. And that tells us that the community spread is increasing, and that's why we have to be ever vigilant. And what governments need to do is think of ways in which we can reduce the spread. So how we've done that this week is send a very strong message to parents, send a very strong message to members of the community, send a very strong message to business and people undertaking certain activity. And that's why we've taken the decisions we've taken, because the less contact, the less social activity, people maintaining a social distance, this all helps reduce the community spread. So to be honest, the number of cases are always worrying when they go up, but what is most concerning is the numbers we need to look at are the community-to-community transmission, and also the number of people we're having to provide intensive care support in our hospital system, because they're the things that are most relevant for us to look at to give us an indication about how we're doing compared to other places, but also they're the things we look at to tell us whether we need to do more as a government to restrict people's activity.
So with the 145 people in this spread here, is there a point in time you can make a firm judgment on, for instance, if somebody overseas travels, eventually the flights will stop and all the Aussies are back, you then wait another month to see that 145?
Yeah, well, I would not think about waiting that long at all. You can't wait that long. What you need to do is make sure you look at those numbers relative to how many people are coming to hospitals, and there's 2 or 3 things you need to look at when you're making decisions about curtailing activity. And I just want to thank all the parents and teachers, because when we gave the direction, people were kind of asking why we did that, and I hope people appreciate why we did that. Schools are safe, but we don't want people moving around the community. We don't want people moving around the community. When people drop kids off, we didn't want parents and everybody interacting with each other in the community, which is why we gave that directive, and I'm very pleased we have, and thank you for listening. We have 10% attendance in our schools. Teachers feel safer, the community feels safer, and while we've done that, kids are learning at home, because I wish I had a crystal ball, but I don't know for how long kids will be learning from home for. I don't know what will happen at the end of the school holidays. But what I do know is that the systems are up and running, and as much as possible we're supporting our students at home, and we know that parents have been doubling up as doing their own jobs at home plus helping the kids with their work, and we appreciate that pressure. And in coming days and weeks we'll also have things that we can support families in that enclosed environment. But today and the next few days is all about making sure we curtail the social activity. If you're out and about, please, including all of you guys, maintain the social distancing. Try not to interact with people you normally don't interact with. It's okay to interact with people at a safe distance if you're used to being in their company, but don't interact with people you don't normally know. These are the special things that all of us need to do, and be extra careful with the vulnerable. The vulnerable are the ones we're all most worried about. Most of us, 80% of us, will get the disease and probably not even know it. Sorry, if 80% of us get the disease, we won't even know it. But for those that do get the disease that are vulnerable, it can have very, very lethal consequences.